The NHS is one of Britain's proudest institutions, but today it faces an uncertain future. Waiting lists are at a record high, staff are overworked, and the cost of care is rising faster than ever before. Yet there's a path forward if we're willing to innovate. This is our proposal to strengthen the NHS by blending compassion, technology, and common sense. First, we must free our frontline heroes from the burden of admin. Doctors and nurses spend countless hours filling out forms, time that could be spent with patients. The NHS has already tested robotic process automation. These digital assistants can automatically reschedule appointments, update medical records, and process repeat prescriptions. Not tomorrow, not years from now. Today. With proper funding and rollout, automation can give staff the breathing room they need and patients the attention they deserve. Next, artificial intelligence. Not to replace our doctors, but to support them. Imagine an AI tool that helps flag missed test results, suggests possible diagnoses, or reminds clinicians to follow up with high-risk patients. These systems are already being trialled in parts of the NHS, with strict oversight, constant human review, and full transparency. This isn't about replacing care, it's about making sure no patient slips through the cracks. Then there's wearable technology. From oxygen levels to heart rate, wearables can track your health in real time and alert your doctor before a problem becomes critical. Already over 70% of NHS virtual wards use this technology for respiratory and heart patients. It helps people recover safely at home and keeps hospital beds free for emergencies. But to make it work, we need national investment in secure, easy-to-use devices and training for those who need support. What about funding? We suggest allowing the NHS to expand its services to include elected plastic surgery, offering paid services in separate lanes, so long as they don't impact public care. The income could go directly back into core NHS services. It's not about selling out the NHS, it's about protecting it and our citizens, with clear rules, public transparency, sustainability, and fairness for everyone. We propose a government-backed healthcare loan scheme which would allow funding for these types of elected surgery, offering a 0% loan which can be paid back as attachment to earnings over the course of 10 to 15 years. Cosmetic tourism? It's costing the NHS millions. Each year, patients return from risky overseas procedures needing urgent repairs. Rather than continuing to allow these unscrupulous surgeries, we propose a public alternative which is less risky, commercially competitive, and beneficial for the long-term sustainability of the NHS. The NHS's biggest problem is that it cannot sustain its own practices. We spend more money than we will ever make. These policy changes would minimize the risk on our population because no longer would foreign cosmetic holidays be an attractive option, where there has been an untold number of medical malpractices and horror stories. By embracing safe automation, AI-supported care, wearable monitoring, and smart funding models, we can preserve what makes the NHS so special and make it stronger than ever. Innovation doesn't have to mean privatization. It means protecting what matters while adapting to the future. Let's save the NHS together. Like, comment, and subscribe.